In 1989, we completely redid the Healthwise handbook. We freshened it and we gave it a whole new look and kind of repackaged it. And anytime that we got an order of 5,000 books, we'd celebrate by one of us would go across the street and buy one bottle of Bud Light. We'd bring it back in a bag of like cheese doodles or something, and we'd bring it back to the staff. We'd gather in Don's office, just a handful of us, and we'd pop open the bottle of Bud Light and rip open the bag of cheese doodles, and we'd pass it around and go, "Oh, we're so hot, 5,000 books."
One great day, we had an appointment with HealthNet in California.
I'm to go down there and pitch the book and the workshops to the CEO.
This CEO wanted to see it for himself. So Molly went, and the day before she went, we talked and said, you know, they're gonna buy books to put on training programs for 20,000 of their members, but they have 300,000 members. Let's tell them that every member who doesn't have a copy of the Healthwise Handbook is at a disadvantage.
So I go down to Woodland Hills and I'm shown to the boardroom. I put my stuff down at the head of the table and I pass out all the packets all around. And I sit down at the table and pretty soon here comes a vice president and then a senior vice president and then the chief medical officer, and they're all nodding, we're talking. They're all just looking at me, kind of smiling. And then the big guy comes in, the CEO or the organization, and he walks right up to my chair and he looks down at me.
Hello, I'm the CEO, Roger Greaves.
And I pick up right away that I'm in his chair. So it's like, "Oh, I'm so glad to meet you." And I kind of scoop up my stuff. I said, "I'm sure you'd like to sit down." And I scoop up my stuff and go way down at the other end of the table. That didn't blow the deal because after a conversation with them, he just said, "You're right. We absolutely have to give this to every member household. So let's do it." Yes!
And that really was the start of what we call the mainstreaming of Healthwise. We started looking at how do you get our ideas and our materials to every person, to every home, for every health problem. It's been a great run ever since.